Hello, my name is Dr. Minda, and I'm going to briefly just go through the uterine and ovarian cycles in females. So, you need to understand that the female reproductive cycle follows a rhythmic change that occurs in the ovary and also in the uterus during the time that a female, or rather a woman, is fertile. That's between 15 to 45 years. So the cycles occur approximately every 28 days, and you have two cycles. You have a menstrual cycle and an ovarian cycle. Now, the ovarian cycle is usually regular. It's a monthly cycle that occurs in the ovary at puberty. And you have three stages in the ovarian cycle. Number one is the follicular phase. So what happens in the follicular phase? This is a phase that is controlled by follicular stimulating hormone produced by the anterior pituitary, and this FSH causes the growth of the primary follicle to mature follicle. So this is what happens. So ovarian cycle, you look at only this, whatever is happening to the ovary. So FSH will be produced by anterior pituitary. Hypothalamus is the one that controls everything within the ovarian and uterine cycle. So it produces gonadotropin releasing hormone that causes the pituitary gland to release gonadotropic hormone. So we have FSH and luteinizing hormone. So this follicular stimulating hormone is the one that will initiate the follicular phase, the first stage of the ovarian cycle, to cause the primary follicle to start maturing, so into a Graafian follicle, then to a mature follicle. So after the follicular phase, we go to ovulation phase. So ovulation is all about the Graafian follicle, which has accumulated fluid. You can see here you have an antrum with liquor folliculi, and this fluid builds up. Then because of that pressure, you have your mature follicle where fluid has built up, and because of that pressure, eventually the ovum will be released together with its corona radiata, and that's what we call ovulation. So ovulation is where the mature Graafian follicle releases the secondary oocyte out of the ovary. So you can see here the mature Graafian follicle comes to contact the surface of the ovary. It forms what we call a stigma, or diminishes the blood supply at that region, and under the influence of enzymes such as matrix metalloproteinases, you're able to disintegrate that part of the ovary to cause ovulation, and that is the release of the ovum, and the ovum will be picked up by the fimbria of the infundibulum of the fallopian tube. And once this ovulation occurs, you have completed your first meiotic division of the ovary. So what factors cause ovulation? There is a sharp increase of luteinizing hormone from the anterior pituitary. You can see you need luteinizing hormone for ovulation to occur. Okay, so you need this ovulation occurs on day 14. Follicular stage, it begins at day 1, ovulation at day 14. So what happens? You need a sharp increase of LH at least 24 hours before ovulation occurs, and then there'll be weakness and degeneration of the ovarian surface at the place where you have the stigma forming. Then because of fluid buildup within the mature follicle, intrafollicular pressure will increase, and that will cause the release of the ovum. Then there'll also be muscular contraction on the ovarian wall. So that's what happens during ovulation. So LH, then you have fluid buildup that will cause intrafollicular pressure buildup. You have muscular contraction, and you also have the weakness and degeneration of the ovarian surface. That's what we said at this point where it contacts the wall at the stigma. There will be weakness and degeneration. You have enzymes that will come in to make that region allow release of the ovum. So what's the fate of the corpus luteum? After ovulation, you go to the luteal phase. So we talked of follicular phase, ovulation phase. So this is follicular phase, then ovulation at day 14, and after that you go to the luteal phase. So if fertilization does not occur, the remaining follicle forms a corpus luteum of menstruation. And then, because there's no fertilization, pregnancy will not happen. This corpus luteum will later degenerate and form corpus albicans, so it will fibrose. So ovum has been released, the remaining follicular cells will form corpus luteum. This will produce progesterone. But if pregnancy does not occur, we don't need progesterone and estrogen. We don't need more hormones. There's no pregnancy to support. Corpus luteum therefore degenerates and forms corpus albicans, which is a fibrosed corpus luteum. So it will be filled with fibroblasts and collagen, so it becomes fibrosed. So those are the 3 stages of ovarian cycle: follicular phase, ovulation phase at day 14, and the luteal phase. So if fertilization occurs, what happens? If the ovum, eventually this ovum that has been released, if it goes to the ampulla and it is fertilized by a sperm, it means a zygote is going to form. So we need to support the developing embryo. So the corpus luteum has to continue producing progesterone that will support pregnancy up to a point where the embryo has implanted and placenta has formed. So corpus luteum of pregnancy is corpus luteum that is actively producing hormones to support the pregnancy before the placenta has been formed. So the oocyte will now, after ovulation, to be picked up by the fimbria into the infundibulum. Okay, and this ovulation causes the completion of first meiotic division. So it will be picked up into the infundibulum, and when it gets to the ampulla, that is where the site of fertilization occurs, and when fertilization occurs, second meiotic division is completed. So in the uterine tube, the oocyte is pushed towards the uterine lumen due to the contractions of the muscles of the uterus, as well as the cilia in the mucosa of the fallopian tube. So fertilization needs to take place within the first 24 hours. So in humans, a fertilized ovum reaches the uterine lumen. It reaches the uterus in 3 to 4 days after ovulation. So it will be picked up, and then it will reach the uterine cavity in 3 to 4 days after ovulation. So then we go now to the uterine cycle. That was ovarian cycle or menstrual cycle. The uterine cycle again is cyclic changes that occur in the endometrium, and usually approximately this cycle is 28 days. It starts at puberty until menopause, and it's under control of the hormones that are being produced by the ovary. So again, we have 3 phases. You have menstrual phase of the uterus, where menstruation occurs, so you bleed from day 1 to approximately day 5. After that, you have the proliferative phase. So the uterus, the endometrium of the uterus starts proliferating, so it's thickening. You can see here it's thin, you've bled, you've shed, so it starts thickening in the proliferative phase. So the endometrial cells start proliferating, and then at the secretory phase, on day 14, ovulation has occurred. So there's an egg that is coming towards the uterus. So the uterus tends to start preparing, in case the ovum is fertilized, start preparing to support the pregnancy. So it thickens, and the uterine glands become longer and tortuous, with filled up with glycogen to be able to support the embryo in case fertilization and implantation occurs. And this is supported by progesterone that is being produced by corpus luteum after ovulation. So basically, the menstrual phase takes 3 to 5 days. That's where you bleed. So we're talking about uterine cycle. So you start with the menstrual phase where there's bleeding. So what happens? Ideally, you had released an egg, but there was no sperm to fertilize it. So since there's no sperm at this area, you release an egg, there was no sperm to fertilize it, and you already have a thick endometrium. What happens? Ischemic phase will come and bring you to the menstrual phase. So the vessels will undergo spasm. That region stops getting good blood supply, so it starts developing cracks and fissures, and then that layer of the endometrium gets less blood supply and starts to shed. So that's the bleeding that occurs during menstruation. So that's the menstrual phase. It usually takes 3 to 5 days, and it occurs 14 days after ovulation. So after ovulation has occurred, this is ovulation. After 14 days, if there is no fertilization, this thickening or buildup of the uterine wall that was already there in the endometrium, if there's no fertilization, corpus luteum stops producing progesterone. So there's no need to support the endometrium. And because of that, vessels will undergo spasm, and then there will be no more blood supply to this thick endometrium. So what happens? It will have to shed, and it will be released in form of bleeding during the menstrual phase. So the menstrual flow will contain unclotted blood and desquamated cells from the endometrium, some mucus from the cervix, and also some of vaginal cells. So After the menstrual phase, the bleeding phase, we now go to proliferative phase, and this proliferative phase occurs together with the follicular phase of the ovary. The proliferative phase, this is proliferative phase, is occurring together with the follicular phase of the ovarian cycle, which occurs before ovulation. And this is under the influence of estrogen. So we've shed blood, then since a follicle is developing, we want to start preparing in case it will be fertilized. So the uterus endometrium starts to thicken. So that's what happens here. Under the influence of estrogen, and the endometrium starts increasing in the thickness, the epithelium becomes columnar, uterine gland starts to form, they become tortuous, and they're filled up with mucin and glycogen. So these are the features of proliferative phase of the uterus. So again, you start to thicken, become columnar, uterine glands are tortuous, they gather mucus and gather glycogen. So lastly, you have the secretory phase of the uterus. So we are here at the secretory phase. So menstrual phase, proliferative, secretory. So this is the uterine cycle, while this is the ovarian cycle with follicular, ovulation, and luteal. So here at the secretory phase, ovulation occurred on day 14. Then we are anticipating that this ovum will be fertilized. So the uterus has to start to thicken and prepare for implantation in case fertilization occurs. So what happens in this secretory phase? It corresponds with the progesterone phase, that is after day 14, and this progesterone phase is the luteal phase because it's under the influence of progesterone. Proliferative phase is under the influence of estrogen. Ovulation is under the influence of LH. So secretory phase, mainly progesterone. So it starts 2 to 3 days after ovulation under the effect of progesterone, which is being produced by corpus luteum. So the endometrium becomes thick, soft, and velvety in nature, and the uterine glands become even more tortuous, and they're filled with even more mucin, more glycogen, and water. So after that, ischemic phase can occur after 14 days, whereby if pregnancy does not occur, corpus luteum degenerates to corpus albicans. So you have less estrogen and progesterone levels, and because of that, the endometrium is not being supported, vessels will undergo spasm, so you get back to your ischemic phase. So and after that happens, you now start breaking. After the spasms, there's no blood supply, so there'll be slowing and hemorrhage because of the breakdown of the endometrium due to lack of blood supply. So basically, after bleeding, you have to repair, and the repair begins at the proliferative phase. Okay, after bleeding in the menstrual phase, you repair at the proliferative phase, so the glands become more tortuous and columnar, and you get to the secretory phase, they even become more tortuous, okay, with more glycogen and mucin. And then if fertilization does not occur, again ischemia because of vasospasm, and then bleeding will now occur. And all these things are happening in the endothelium, the functional layer of the endothelium. So how do you apply this knowledge? It helps to time fertility so that somebody knows the right time for intercourse. It has to be at ovulation period, because after an egg has been released, within 24 hours it should be fertilized. So, and then you also need to know when to use contraception if pregnancy is not intended. So during that period of ovulation, you need to use contraception at least 6 days before ovulation and 6 days after ovulation to be sure that fertilization will not occur. Then we also have another clinical application of menstrual irregularities such as menorrhagia, when you bleed too much. You have metrorrhagia, amenorrhea, where you're not bleeding at all, polymenorrhea, you're bleeding frequently, and oligomenorrhea, where you have bleeding but it's very little bleeding. So all these are menstrual irregularities. Thank you. Another menstrual irregularity, menstrual issue is dysmenorrhea, where there is menstruation associated with pain. Thank you very much.